There are a number of changes that we put in place to keep our staff and our patients safe during the COVID-19 pandemic. Chief among these has been to try to reduce the number of staff on site. In order to do this, we've allowed staff to work remotely from home when appropriate. We've also gone through lengths to limit the number of patients that we're seeing at the hospital. We've reduced the outpatient clinic visits and restricted them to only urgent and emergent visits. All elective visits and scheduled appointments have been postponed. We're also doing only non-elective, that is urgent and emergent surgery. Elective procedures have been postponed. We are also ensuring that our staff and our patients have the appropriate protective equipment during any encounters, including masks and face shields, goggles, and gowns and gloves. So I think we're using technology in a variety of innovative ways during this time. One, as I said, is our staff are working from home and they're taking advantage of technology to carry out some of their normal job duties, both patient care responsibilities and administrative functions. We're implementing a number of telehealth initiatives to allow us to both triage patients and provide care to them remotely during this time when we are minimizing actual in-person visits to the hospital. So both telephonic and video conferencing are being used to perform patient encounters. We do have a plan in place to redeploy physicians, and we're making preparations for that. At this point, our physicians are currently working at New York Eye and Ear, both our trainees, our residents and fellows, and our attending physicians. We are prepared, though, to deploy physicians to other areas of the health system, depending on needs. The goal would be to allocate our resources, our physician resources and staff, to the areas that have the greatest need for patient care. I think I've learned a lot about both myself and the staff at New York Eye and Ear. We definitely have shown a lot of resilience during this crisis. Everyone has really stepped up and really contributed a lot to ensuring that our patients continue to get good care. Everyone has contributed to contacting patients, to rescheduling appointments, to following appropriate safety protocols, both in terms of wearing protective equipment and the willingness to adjust their schedules and their approach to patient care in order to meet the needs that this unprecedented crisis has created. I think that during this time, your personal safety and that of your family and loved ones is most important. We're all looking forward to resuming our normal routines, but until such time, it's of paramount importance to be careful, and if any questions arise, to seek assistance via telephone, and as always, stay safe.